So thank you, everyone.
I will skip the intro slide for time purposes. So we're going to get right into our next presentation. If you're just joining us, again, housekeeping, muted and cameras off. We're recording. Any questions, comments, you can put them in the chat. We will have a SERAC staff will be paying attention to that. So up next, we have Kelsey Binnie and Emmalyn Walenda, and they are our program program coordinators, and they're going to do substance exposed children challenges and collaboration.
Everyone can hear me?
Yes.
Yes, we can.
Awesome. Can everyone see my screen?
Yes.
Yes, we can.
Awesome. Well, good afternoon, everyone. My name is Kelsey Binnie. I'm with a program coordinator with SERAC. I'm joined by my colleague, Emmalyn Walenda. For the next hour, we'll be discussing substance exposed children. If you're just joining with us, we're program coordinators with SERAC, which is the Regional Behavioral Health Action Organization for the 41 towns of Eastern Connecticut. We work to address behavioral health needs at the regional level, aiming to improve access, quality, and coordination of services across communities. Emmy and I specifically work on grants focused on opioids, suicide, and vaping, but our other colleagues you've heard from today or who are up after us cover other areas of need. Today, we are going to be defining who drug-endangered children are according to the National Alliance for Drug-Endangered Children. You might hear us say drug-endangered children a lot, or you might hear us shorten it to DEC, just for not saying it. It's a mouthful. We're going to be covering risk factors and some specific substances and their effects on children. We do have a few videos, some time for some audience participation. So whatever you feel comfortable when we get to that part of the presentation, coming off mute or entering your responses in the chat, that'd be greatly appreciated. And if the technology gods are on our side, we do have one interactive slide that has a QR code you can scan and respond with via text. But you can also go online, like the web browser will be there. The link will be there. We do want to note that some of our materials and content in this course can be graphic or disturbing in nature. We do encourage you to take care of yourself as needed. So we know that it can be triggering. So if you do need to turn off your camera or take space through the presentation, please feel free to do so. Next, we have a video, hopefully it plays, from the National Alliance for Drug-Endangered Children, a really good introduction to the organization. Just gonna make sure my volume's up before I hit play.
Who are drug-endangered children? In this short course, we'll look at who drug-endangered children are and why they need your help. In the United States, an estimated 9 million children are at risk because they live in homes where at least one parent has a substance use disorder. These are only the children who have been identified. We know there are many more who have yet to be identified. When Amy was 10, it was her job to wake her younger stepbrothers, find food to feed them, and wait with them for their school bus before getting herself to school. Most mornings, her mom and stepdad were either not yet home from their latest drug binge, or they were passed out and unable to care for her and her step-siblings. The National Alliance for Drug-Endangered Children defines drug-endangered children as children who are at risk of suffering physical or emotional harm as a result of legal and illegal drug use, possession, manufacturing, cultivation, or distribution. They may also be children whose caretaker's legal and illegal substance misuse interferes with the caretaker's ability to parent and provide a safe and nurturing environment. Amy's home life was chaotic for many reasons, as she essentially parented and helped protect and provide for her younger siblings. She made sure they showered, and brushed their teeth, and she helped them with homework, which meant Amy had no time to do her own homework. As a result of several years living in this situation, Amy failed in school. Children growing up surrounded by substance misuse are almost 3 times more likely to be verbally, physically, or sexually abused, and 4 times more likely than other children to be neglected. Amy was sexually abused by her biological dad when she was 6 years old, and later by her stepdad. She was also physically abused by her mom and stepdad, and an abusive boyfriend when she was older. Research shows an increased likelihood that children who have experienced trauma will misuse alcohol and other drugs. Without intervention, the cycle of substance misuse may continue from one generation to the next. As an adult, Amy realized that she tolerated being treated poorly because it was how she grew up and what she knew as normal. You can help drug-endangered children through identification and support. Many professionals from many disciplines see the risks and the subsequent impacts of parental and/or caregiver substance misuse and drug activity every day. These professionals are key in identifying children at risk at the earliest point so that intervention can be provided to change the trajectory of children's lives and to help break the cycle of multi-generational substance misuse. In DEC efforts, identifying these children will prompt a collaborative response and intervention by multiple professionals. Amy's mom and stepdad eventually divorced, but Amy maintains a relationship with her younger brothers. She got herself help through school and connected with an alcohol and drug prevention specialist and a therapist. She eventually got her high school diploma and continued down her own road of healing to break the multi-generational cycles. Today, you learned about who drug-endangered children are, the risks they face, and why it's important to identify them as early as possible. Each and every one of us can change the status quo and change the trajectory of the lives of drug-endangered children. The National Alliance for Drug-Endangered Children was created to help you with this. We provide a variety of in-person and virtual training opportunities, monthly newsletter, a free mobile app called Check Deck, a Drug-Endangered Children Alliance roadmap and toolkit, and other resources. Contact us at info@nationaldec.org or visit nationaldec.org for information about additional trainings and resources.
All right, can everyone hear me okay?
Yeah.
Okay.
Yes.
So as we heard in the video, the definition of substance-exposed children, according to the National Alliance for Drug-Endangered Children, is children who are at risk of suffering physical or emotional harm as a result of legal and/or illegal drug use, possession, manufacturing, cultivation, or distribution. Also, they may be children whose caretakers' legal and/or illegal substance use interferes with the caretaker's ability to parent and provide a safe and nurturing environment. So since we already know the definition of substance-exposed children, I also want to look at kind of what are those visual indicators or observations that can help us identify a substance-exposed child. So there are observations which look at the more clinical or direct indicators. So those may be positive toxicology screens at birth. So those are more direct compared to maybe a behavioral indicator observation, such as a drop in attendance at school or work. So that maybe you have to look at or directly analyze as well. So other observations and indicators include environmental, behavioral, psychological, and physical as well. So environmental, of course, may mean those conditions within specific locations, such as within the home environment, whether it be also within a family's residence or just anywhere where the child may be. Behavioral looks at more of those changing behaviors or changing child actions. So it may be the child has a drop in attendance at school or work, or they're engaging in more secretive or suspicious behavior. And then there's also psychological indicators, or any sudden changes in attitude, personality, or overall mood, while physical indicators are those that have to do with the individual's appearance, so such as listed bloodshot eyes, extremely dilated pupils, or others as well. And I also wanted to ask if anyone in the audience works with families or children, whether it be indirectly or directly. What are some observations that you see in your line of work, or maybe some that we missed as well? And feel free to either come off mute or put it in the chat. Just have a conversation. Yeah, so Megan said students taking parent cannabis to school for distribution. Yep, so students may be taking that substance to school. I know sometimes we also may see more of those physical indicators too. So whether it be with the parent, so maybe looking with the bloodshot eyes, dilated pupils, or even if maybe if you're an individual working in DCF as well, kind of going into the home, seeing different drug paraphernalia, or maybe it's needles, different substances, just different observations and indicators too. Yep, so now we go on to more postnatal risks. So children face serious risks when they are exposed to substances, which can impact their mental and physical well-being. So postnatal risks include anything from drugs transported in children's items to a lack of supervision, lack of necessities, human trafficking, and ingestion and exposure, which we often hear about related to poison control as well. And also, I just wanted to kind of gauge the room in terms of, are there any that anyone believes are more common or they see throughout their line of work too? Yeah, so supervision, definitely be a firearm. So definitely maybe if the parent is out, maybe with other individuals, not having that supervision can lead the child to either have more access to that substance or also end up not having proper supervision and ending up getting in trouble as well. So in terms of,
Sorry.
no, you're good. So in terms of risk statistics, children of parents with substance use disorders have a higher likelihood of developing substance use problems themselves. And children whose parents misuse alcohol or drugs are 3 times more likely to be verbally, physically, or sexually abused, and 4 times more likely than other children to be neglected. Since we just talked about child abuse and neglect, children who experience child abuse and neglect can face long-term impacts. So they are 59% more likely to be arrested as a juvenile, 28% more likely to be arrested as an adult, 30% more likely to commit a violent crime, and 2/3 of the people in treatment for substance use reported being abused or neglected as children. Understanding the lifelong effects of child abuse and neglect helps us recognize just how deeply early experiences shape the child's future. But it's not just the negative experiences that leave an impression. So children also absorb the behaviors, emotions, and attitudes of the adults around them. And so we're going to shift focus a little bit and watch a short video that illustrates how powerfully children mirror the adults in their lives.
Let me know if you all can hear it.
It don't come. I'm stuck like a specimen.
So the video may have been lagging a little bit, or the audio may have been a little wonky, but definitely, as you see there, the children were kind of mimicking the adults' behaviors. Whether it be from the beginning, it was more of that negative aspect, but then towards the end, you can kind of see the end where the child was helping to pick up different things on the ground, so that positive behavior as well. So this previous video exemplifies the significance of that nurture component that we often see in the nature versus nurture debate that many individuals may have, that you may have had within your biology course in high school or middle school, or in college as well. So when you look at the nature versus nurture debate, nature is the pre-wiring and is influenced by genetic inheritance and other biological factors. And nurture is more of the experiences, the environment and upbringing that the child may have. So this may focus on parenting strategies, relationships with parents and other community members, and additional factors that were related to more of that experience, or other factors too. So when we specifically bring exposure to substances back into the equation, the exposure acts as a negative and harmful influence regarding the nurture aspect, and it also acts as an adverse childhood experience. So many people know adverse childhood experiences, or ACEs, they may call them. So ACEs are potentially traumatic events that occur during childhood from anywhere from when they're 0 to 17 years of age. And so on the graph to the right, you see that there are different types of ACEs. So that can be different categories of abuse, neglect, so whether that be emotional, physical, or sexual abuse, or also emotional and physical neglect, or also household challenges. And I also want to note that substance misuse is noted under the household challenges as well. But it's also important to notice that adverse community environments, such as systematic structure or community challenges, can often be the foundation for further issues. There would be the root of many of the adverse childhood experiences, including parental substance misuse. So if we're taking, maybe for example, a lack of opportunity within a community, we can look that may increase stress or mental health within the guardians or parents of the child, and they can also lead to more mental health challenges amongst populations, potentially contributing to substance use. So children that experience ACEs frequently endure toxic stress. So you may or may not have heard of toxic stress before, but it is the severe and long-lasting stress response. So when people are kind of in that fight or flight mentality, so when we're kind of more on edge all the time, we have that stress, anxiety, kind of like Rihanna was talking about earlier. So a kind of more of an analogy, a representative analogy that many people think about when they think of toxic stress is when we have a car running or the motor or engine running consistently nonstop. So it overworks the individual, overworks the object or individual, in the sense the car, and negatively impacts the individual's body. So we're seeing that it will have a negative impact on mental health as well as physical health. So exposure to toxic stress and adverse childhood experiences, or ACEs, can lead to long-term physical and mental health problems. Chronic activation of the stress response system can disrupt brain development, impair learning and memory, and increase the risk of anxiety, depression, and behavioral disorders. Over time, this stress can also weaken the immune system, elevate the risk of chronic diseases such as heart disease, diabetes, and obesity, and contribute to substance use and poor health behaviors in adulthood. So you can see that in the image on the left. It contributes to various injuries, mental health challenges, as well as substance use. So we had the opportunity to look at more Connecticut adverse childhood experience data. So in the state of Connecticut in 2021, over 6 in 10 youth reported at least one ACE, and many youth report 2 or more ACEs, with 1 in 6 reporting 4 or more. So as you can see in this graph, the 6 in 10 youth reporting at least one adverse childhood experience. So you can see that there's still room for intervention or prevention measures to be put into place as well to help children and to address adverse childhood experiences. Also mentioned in previous presentations is the positive childhood experiences. So research also shows that there's a positive childhood experiences or PIECES that can assist in mitigating the traumatic impact of adverse childhood experiences. So PIECES are defined by the American Psychiatric Association as a set of interpersonal relationships between family, friends, in school, and in community that fosters a child's capacity to thrive. So examples of PIECES include feeling safe and protected by a caregiver, having supportive friendships, enjoying school, participating in a family or cultural traditions, being able to talk to family about feelings, and having adults outside the home who will care and offer encouragement. So similar to ACEs, PIECES have impacts on health outcomes, but they kind of have the opposite effect. So PIECES aid in lessening the long-term impacts of ACEs due to their focus on building healthier emotional and social development, stronger relationships, and greater resilience throughout life. National data shows that PIECES are positively associated with educational attainment and income, as well as have various lifelong health benefits. So the 2019 Montana Behavioral Risk Factor Surveillance System data shows that higher PIECES or positive childhood experiences are associated with lower use of illicit drugs, as well as any type of overall substance use. Furthermore, 2021 Tennessee Behavioral Risk Surveillance System data reports that PIECES also assist in lowering rates of depression and heart disease, and also help to improve adolescent mental health and general academic skills in a longitudinal survey of children in Australia. So the significance of PIECES' ability to mitigate the long-term effects of ACEs is shown more in that left-hand side graph on the top. And it shows that individuals with 4 or more adverse childhood experiences, with that the greater amount of positive childhood experiences that they had, the percentage of depression or poor mental health decreased. So you can see that within the 0 to 2 positive childhood experiences, there's a higher percentage of depression or poor mental health. then as you go down to the 6 to 7 experiences, it kind of goes down as well. And once again, we looked at data from the CT Data Collaborative and the YRBS from 2021, and we looked at Connecticut data in particular. So in 2021, it shows us that 95% of youth reported experiencing at least one PCE or pieces, with 56% experiencing 5 or more, with a maximum of 7 pieces indicators. So we see that there's a lot of individuals or children reporting 5 or more, so being that 56%, but there's still room to improve, with 0 being at 5% of youth, and still 1 or 2 being with 10% of youth. So there's still room in intervention as well to kind of grow and implement and share how positive childhood experiences can help to mitigate ACEs.
All right. Now, after hearing from Emmy, I want to dive a little deeper into some more specific substances and their impacts on children and families. So, again, we start with a little bit of Connecticut data specifically. So this is the prevalence of current substance use by age group. Looking at this graph, we want to note that the current substance use does refer to substance use within the past 30 days. I also want to note that this is from 21 to 22. So prior to cannabis legalization and retail licensing in Connecticut. So those statistics for 23 to 24 might be a little bit higher than this data. But in this graph, you can see young adults age 18 to 25 report the highest prevalence of substance use for all substances except alcohol compared to their other age groups. Reported past 30-day use is highest for alcohol, 60%, and binge drinking at 35%. Rayon kind of touched on that a little bit. Alcohol and cannabis and marijuana are the most reported substances of current use by Connecticut youth ages 12 to 17. And then reported prevalence of binge drinking and cannabis and marijuana use do taper off from young adults to adulthood. So looking at alcohol, according to the 2017 report by SAMHSA, approximately 10.5% or 7.5 million children in the United States under the age of 18 live with one parent who has alcohol use disorder. That's roughly 1 in 10 children growing up in homes where alcohol misuse is a serious issue. Zooming out a little bit to the general population, in 2023, the National Survey on Drug Use and Health reports that more than 177 million people ages 12 and older, that's 62.5% of this age group, said they drank alcohol in the past year. This shows how widespread, that alcohol use is in our society. Again, kind of going back to Rayon's presentation from before. Among pregnant women, the numbers are still concerning. According to the CDC's Behavioral Risk Factor Surveillance Survey conducted from 2018 to 2020, nearly 14% of pregnant women ages 18 to 49 reported current drinking. Again, thinking about the risks for both the mother and unborn child. Looking at alcohol use disorder in parents and how it affects children. Children of parents with alcohol use disorder are 4 times more likely to develop the disorder themselves. And the cycle, can continue through generations. These children are also at an increased risk of developing dependencies on other substances. In fact, they have a 1 to 10% chance higher risk of becoming dependent on other drugs like opiates, cocaine, or marijuana. I know Megan and Jess talked about cannabis earlier. I wanted to touch on cannabis. Cannabis is a plant that's used in a variety of forms. It's dried leaves, flowers, and stems, and seeds contain active compounds. One of the main chemicals of cannabis, gosh, tongue-tied today, which causes that mind-altering effect, is that THC. It's the most commonly used illegal drug at the federal level. In fact, in 2021, over 52 million people, nearly 1 in 5 Americans reported using it at least once. When it comes to children, they can be unintentionally exposed to marijuana in 2 main ways, either by inhaling secondhand smoke or eating marijuana-infused foods. Secondhand smoke comes from the end of a joint or whatever the user might be using. If it's in the air, children and especially infants can breathe it in. More concerning, I think now, is when kids accidentally eat marijuana products. Many of these edibles are designed to look like everyday snacks, which make them really attractive to young children. These edibles often contain higher levels of THC than found in smoke, which means they can be more dangerous. And in some cases, kids have needed hospital care, intensive care, or after consuming them. I think one statistic I don't have on the slide is regular marijuana use in adolescents can found to increase 2 to 5 times of developing psychosis, schizophrenia, anxiety, or depression. Next, we have opioids. I want to discuss a little information about opioids. If anyone might be a little unfamiliar, opiates and opioids are both types of drugs used to relieve pain, but there's a key difference in how they are made. Opiates are naturally derived from the poppy plant. Some examples include morphine, codeine, opium. These come directly from nature. Think of them as plant-based painkillers. Opioids are a broader term that includes synthetic and semi-synthetic drugs, and some examples include oxycodone, fentanyl, and hydrocodone. These are either made in a lab or modified versions of opiates. All opiates are opioids, but not all opioids are opiates. Both types act on the same receptors in the brain to reduce pain, but they also carry a very high risk of dependence, overdose, and death. Babies exposed to opioids in the womb can be born with a serious condition called neonatal withdrawal syndrome, or also known as NOWS. Federal data shows that a baby with NOWS is born every 15 minutes in the United States. Some symptoms and complications of NOWS: babies face low birth weight, breathing problems, feeding difficulties, and in severe cases, seizure and tremors. They tend to require longer hospital stays and specialized care. Doctors do urge pregnant individuals using opioids to seek support and prenatal care, potentially to greatly improve the outcomes of both the individual and the baby. From 2019 to 2016, nearly 9,000 children and teens in the United States died from opioid poisonings. Some of this data might be a little bit old, but I think still relevant. In a study from 2005 to 2018 in 40 states, opioids were the most common substance contributing to death, followed by over-the-counter pain, cold, and allergy medications. Opioids accounted for 24% of the substances contributing to death compared to 52%, and that's in kids under 5, I believe. According to the Drug Abuse Warning Network, in 2011, an estimated 4,321 emergency department visits involved accidental ingestion of opioid pain relievers by children age 1 to 5. Those number of emergency visits increased from 200% from 1,437 in 2004 to 4,321 visits in 2011. They did note from 2009 to 2011 that those department visits were stable in those years. And combined 2004 to 2011 data show that estimated 22,174 visits involved accidental ingestion of opioid pain relievers by children 1 to 5. An estimated almost 6,000 of those visits involved hydrocodone products such as Vicodin and 4,365 involved oxycodone products such as Oxycontin or Percocet. I know it's really alarming to hear these statistics when thinking about kids under the age of any kids really, but exposed to substances in the home. We did just cover opioids, but they do fall under my next two slides, which are prescription drugs. So they are in the same family, some of them. Prescription drugs are medications that can be dispensed with a healthcare provider's authorization. These aren't available over the counter, so you do need that prescription to get them. Three major types we do talk about when it comes to prescription drug misuse is opioids. For pain relief, like I mentioned, Oxycontin, Vicodin, depressants for anxiety or sleep issues, such as Xanax or Valium, and stimulants for attention disorders, such as Adderall or Ritalin. Non-medical use means taking a prescription drug in any way other than how it was intended. Some things might include taking more than your prescribed dose, using someone else's medication, or getting a drug illegally without a prescription. Most people do use their prescriptions as directed, but misuse still affects millions of people. Around 6.5 million people aged 12 and up reported that reported as current non-medical users. That's about 2.5% of the population. And of those, about 1.9 million were dependent on misusing a prescription pain reliever specifically. Among teens, misuse is a growing concern. According to a national survey, nearly 18% of high school students admitting to taking a prescription drug without a doctor's prescription. This includes drugs like Oxycontin, Adderall, and Xanax. Prescription drugs can be life-saving when used correctly, but misuse can lead to serious consequences, including addiction, overdose, and death. Here, the adolescents surveyed by the Partnership Attitude Tracking Study. These are reasons reported for misuse of pain relief medication. As of their result, the availability is in the green, lack of consequences in the yellow, and perceived safety of prescription drugs in the red. Most teens abusing prescription drugs report getting them from friends or family members. However, 1/3 report getting them from their own prescriptions. Making sure that we need to be monitoring teens taking opioids and evaluate how they are being prescribed. Something particularly dangerous is when young people indiscriminately mix and share prescription drugs, again, which is kind of a current trend, combining them with alcohol or other drugs. I have that coming up in a couple slides. Here's some poison control information. So 32.1 poisoning exposures in children younger than 6 years per every 1,000 children. That's national statistic, and again, nationally, in a study of poison control center data, teenagers and children less than 5 years of age were the most common age affected by cannabis edible exposures. The two graphs on the bottom, the one on the left and the one in the middle, are all three are Connecticut data. But in 2023, children under the age of 6 were almost the second highest group that had that cannabis exposure. This doesn't differentiate whether it was edibles or that dried leaf. And then in 2024, the numbers did go down, but that age group, 6 and below, again, are the second highest group that accidentally ingested cannabis in one form or another. And then on the right is the overdose data for opioids. And this is showing that under the age of 15, there's 1.1% who overdose deaths for opioids. I know Megan and Jess mentioned safe storage of medications, but it is one of the simplest and most powerful ways to prevent misuse, accidental poisonings, and even overdoses, especially among children and teens. Storing all medications in a secure place, such as locked cabinet, drawer, or box. Don't leave them on counters or in purses or anywhere children or visitors can easily access them. Keeping prescription medications separate from over-the-counter ones and store each person's medication separately to avoid mix-ups. Always keeping medicines in their original labeled containers. This ensures dosing instructions, expiration dates, and patients' names are clear. Child resistant doesn't mean child proof. Kids can still get into bottles if they're so determined. So locking them away is always best. I always tell people about my three-legged dog and how she once opened a bottle of ibuprofen by herself, and it was not a fun experience. Keeping track of how much medication you do have. If you do notice any is missing, it could be a sign of misuse or theft. Talking to your kids and teens about the dangers of misusing prescription drugs and letting them know medications are not safe to use unless prescribed for them. Don't let old prescriptions pile up. Use take-back programs. We just had one in April. There's another national event coming up in October. Or a lot of local police stations have take-back programs where no questions are asked. You can dispose of your prescription drugs there. I know I mentioned a lot of scary statistics, but still talking about teen substance use has been declining for decades. The one area where we do see an uptick right now is prescription drugs. Again, back to that safety. They think it is safe. It might not be prescribed to them, but there's this perception that since it's a prescription, it's over the counter, it's not illegal, it's not coming off the street. It seems safer to them. So that is an uptick, specifically in teen females that are using prescription drugs. And again, teen marijuana use has been declining since 1999. I have a video. Let's see if I can play this without the audio. I'm getting off track.
When someone is struggling with addiction, it affects everyone in their world, especially children. For kids, it feels like everything is crumbling around them. Forces they can't control begin shaking their lives, and people they love begin drifting away.
Addiction is like a cancer. It doesn't just affect the person who's using, it affects everybody around them. They're the ones picking up the pieces when things fall apart.
We know that living with or near addiction can be overwhelming, no matter how old you are. We're here to help with resources, with training, with care and support.
There was no way out. I thought I was going to die with a needle in my arm. And then I was set free. I'm on this journey with so many other friends that are in recovery. That's our support, you know, to know that you're not alone in this and that you can do it. Like when I was in active addiction, you know, I was afraid of all those people and all the social workers, and just seeing everyone in the community come together to try to combat the epidemic, knowing that they really do care, is huge.
At the National Alliance for Drug-Endangered Children, our mission is to help families find a way forward. No matter how deep the substance misuse has taken hold, there are strong pathways to recovery and caring professionals available to help.
In the drug war, the kids are oftentimes the collateral damage. They're the forgotten ones, the first impacted and the last ones helped. We want to change the trajectory of children and families' lives in communities across the United States. We want them to have an opportunity. We want them to be identified earlier. And we want professionals to look at what's best for the child as a whole, the family as a whole, and ultimately impacting the community as a whole as well.
For the children, for the caregivers, for the addicted and all those working to help them. We can help you find a way. Learn more.
I really enjoy that video from the National Alliance. It really does offer hope and a nice kickoff to our collaboration start of the presentation. But looking at what collaboration means, working together across individual groups to reach a shared goal involves exchanging information, coordinating activities, and sharing resources. True collaboration helps everyone involved, not just one side. Everyone gains something from partnership. It's also about strengthening each other's ability to contribute, helping partners grow and improve along the way. All right, this is my slide. If you are able to, you can either go to that website, polev.com/kbinnie051, or you can scan the QR code, and as you type or submit your responses, we're looking to know, what does organizational collaboration currently look like at your organization? If you are, in a supportive role, service role, what does that look like? Vital part of what we do, strong collaboration. That's great to hear. Working together, supporting each other to accomplish common goals. Yes, we love that. Not working in silos. Yes. Couldn't do what we do without our partners. Excellent. Any more? Regular collaborative engagement. This is great. With various state agencies and contracted providers before, during, and after care. Makes change more possible. Oh my gosh, this is so wonderful, everyone. Solid, great communication, and collaborate together on events, collaboration through the state. All right. That's great to hear. Brainstorming ideas on how best to serve our clients using local resources. Awesome, awesome. I think we got great feedback. I don't know if I was expecting it to sound so great, but I don't know. Someone said something about silos, which is awesome for our next slide. Did it go? How do I get it to change? It's changed on my screen.
It changed, Kelsey. You're good.
We did it. So I'm not sure who said not working in silos, but this is a perfect example of that. In each of the silos on the top picture, we have everyone working separately and not communicating or partnering with each other, but using DEC and being supportive. That arrow, kind of that catch-all of drug-endangered children, and being able to not let any child fall through the cracks. I was wondering, I think the last slide was really positive feedback and collaboration, but I was wondering if there's any room for improvement, or if you could paint like that beautiful picture of how to make your job easier and better to support the children and the families you work with. What could that look like, or what could you hope for to make that either easier for you or you and your colleagues, your organizations? Wondering if someone might be able to either jump off mute or put it in the chat. Hoping Emmy might be able to read the chat if people are putting their experiences in the chat. Again, how might we be able to better promote partnerships?
Yeah, so Megan said more time in the day for parents to be able to attend trainings to support growth.
Thank you, Megan. Anyone else? All right, I know we're coming up on time here, so I'm going to go to our next slide. I wanted to talk about some real life examples of what it might look like if we didn't change and we didn't have support. But a law enforcement officer might observe a suspect bring an infant child to a drug deal. A teacher might have an 8-year-old student who has been late to school on numerous occasions. They fall asleep in class and recently has been quiet and withdrawn. Child welfare might be investigating a report of neglect of 3 children, infant, toddler, and an 8-year-old that don't appear to have adequate adult supervision. So this is a real life example of if DEC didn't exist, they're each their individual puzzle piece. When in fact the entire family and discipline in this case failed to connect all the puzzle pieces, which results in them only having one piece and not getting appropriate services. Knowing who all are involved in a child's life allows us to have more pieces to the puzzle. Law enforcement, prosecution, fire EMS, educators, medical treatment, probation, child welfare. Is there anyone missing on this slide? Any organizations that will help build that puzzle? This is what we want our puzzle to look like. This picture illustrates when it all comes together and we're able to partner and work best to support those children and families. One example of a person who did change the status quo is Candace Leitner, who is the founder of Mothers Against Drunk Driving. Following the death of her 13-year-old daughter, she began a grassroots organization to change laws and societal attitudes towards drunk driving. You know, if you're looking at 1980, she incorporates MAD. It grows to 11 chapters. And then, it slowly grows. 1982, 100 chapters. 1983, 121 new anti-drunk driving laws passed. And today there's more than 300,000 lives saved and more than 50,000 victims served. It's a great example of how partnership grows over time, but we're able to support those in our communities of families and children. Are there any questions? Any thoughts? Feelings? Right, a couple more slides. Here at SERAC, we do have a 30 or 90-minute DEC training available for your organization. We can do them in person or virtually. We're able to do this presentation as well, but feel free to contact us if you'd like to come in. We do want to end with this quote from anthropologist Margaret Mead. Never doubt that a small group of thoughtful or committed citizens can change the world. Indeed, it is the only thing that ever has. We recognize at SERAC we don't have direct support services, but we do have a great DCF liaison. And if there's any way we can partner with you or your organization, we're happy to explore kind of any opportunity to best support all of our communities. Emmy and I wanted to thank you for attending our presentation today. And if you have any questions, feel free to contact either of us. If you scan this QR code, you should get our evaluation. If it's not working for anyone, I can email or drop the link in the chat.